So to friends at EOHSI, Public Health, SEBS, retired faculty, wherever you may be. So I'm really pleased to introduce John Keith to talk about toxic contamination in developing countries. John is an environmental engineer with about a half century of experience, much of it in developing countries all over the globe, Asia, Africa, the Americas, including some years of experience in a place called New Jersey. He serves as the lead technical advisor for Pure Earth, an organization that works to identify, clean up, and solve problems, pollution problems, in low and middle income countries. And with our departments refocusing on environmental justice, I read the Pure Earth mission as global environmental justice, and I've advertised it as such around campus. So toxic pollutants, whether shipped from abroad or generated by polluting sources within, have devastating health impacts, especially on children. John started his career at the New Jersey Department of Environmental Protection. He's in charge of pollution and solid waste. And he then spent many years in environmental health and safety and environmental affairs at some familiar names like Hoffman LaRoche, Schering-Plough, Pfizer, some of those facilities we used to visit that are no longer with us. With Pure Earth, he investigates air, water, and soil pollution by metals, pops, pesticides, and other things. And he has some important stories to tell us. So I'm going to say, John, take it away.
Well, good afternoon for everybody, unless you're way on the far West Coast. It's a pleasure to be here. I think back on my days working with people in Rutgers many years ago. I'm located in Cape Cod now, but I travel all over the world working on toxic pollution sites. I'm going to be sharing my screen now if I can. And I hope that's visible. We'll be talking about toxic contamination in developing countries, the extents, causes, and impacts, and actions. The focus of Pure Earth, as was stated in the introduction. As with many of these things, I'll have a whole deck of slides here. I hope we can use the chat if there's any questions, and there's certainly time at the end of this to talk about any questions that you might have. Throughout the presentation, you're going to see a lot of pictures. So if nothing else, if you are not familiar with what toxic contamination looks like in the developing world, you'll see a lot of pictures of what that looks like. You can see one right here, which happens to be the Absheron Peninsula of Azerbaijan. I think 24 countries are represented. Now, how do I? Oh, there it is. So these are the topics I'd like to cover in this discussion. First, how the toxic contamination relates to other environmental problems facing the planet. Then we'll talk about the types and extent of toxic contamination, narrowing down eventually on specifically toxic contaminated sites, which is a focus of Pure Earth. And then we'll talk about numerous examples, and then a few case studies, notably in Nigeria and Somaliland, that Pure Earth and I have worked on. So Pure Earth, as the introduction gave, is an international nonprofit based in New York, formerly Blacksmith Institute, with a mission to identify and clean up heavy metal and toxic contamination. We do not work on large global scale pollution issues like global warming or regional air pollution. And we do not work in Western Europe or North America. We're focused on low and moderate income countries, sometimes called developing countries, where we find that the sites are not well identified and resources are often limited. We do not pretend to be able to clean up everything in the world. So a key focus of Pure Earth is to spur efforts by national governments, the UN and other organizations to understand and take action. We have been founded since the turn of the century and work in some 27 different countries. And the strategy that we used to execute our mission is first to identify toxic hotspots around the world, so over 5,000 so far in 50 countries. We implement pilot studies with a focus on their potential to scale up and use as a capacity building exercise for national and international agencies and where there's a public health benefit. As I stated before, our strategy is to help countries and international agencies understand the issue and build capacity and develop strategies to address toxic contamination. We are not an advocacy organization. We work to solve the problems. We do not attack governments or people in the press, because that only turns them off and then we can't work with them. We have a technical advisory board of some 50 senior experts to help give us the best science and best practices. So I'll start putting toxic contamination in some context. You can classify the environmental problems facing the planet in lots of ways. I've divided it here into 6 different crises: desertification, global warming, invasive species, fresh water, ocean health, and toxics and air pollution. And these things massively interact with each other. So you can't really solve one without addressing the others, and you can't really understand one without addressing the others. So I'm going to have some discussion about these 6 crises and the interactions in between them. I'll note that toxic contamination and air pollution are 2 sides of the same problem. Air pollution is basically toxic pollution. It's the same substances that cause the same sort of health impacts, whether they're in the air or the water or the land. So here's my model of how these 6 crises interact. You have to look at first root causes. And the root cause of these problems are basically our big brains. Our evolutionary survival strategy is to be able to plan and foresee actions and to change our environment. And as a result of our big brains, we've created technology. And that has allowed us to do all sorts of things. But it has also resulted in creating a whole bunch of environmental problems. And the ultimate effect of what we're doing is reduced biological capacity on the Earth, which includes extinctions and species loss, and our own food and water insecurity. So a little discussion about the root causes. Again, the big brain, the technology that we have has resulted in us being able to massively alter the Earth with cities, roads, agriculture, mining, forestry, overfishing, dams. It's also resulted in massive population growth, notably due to sanitation, antibiotics, and vaccines, improved food production. And we can live in areas that were never lived in before because of heating and air conditioning. Nobody would live in Phoenix today if it weren't for air conditioning. And we've even got malaria under control under most of the planet. We also live a lifestyle that's undreamed of by our ancestors. So we have unprecedented resource consumption in a whole bunch of areas, which is facilitated by globalization and our ability to ship things everywhere. So all of these things have contributed, and that's why we're having a problem now, and it's why you didn't have a problem 2,000 years ago. We also have a philosophy of waste in our global economic model. This isn't new to anybody, and that contributes to everything. all of these problems. I won't go through what they are, but one of my pet peeves is one-time consumer use in plastics and packaging, batteries, toys, bottles, cleaning compounds, chemicals, all sorts of things. But all of our waste in society, we have nothing close to resembling a closed loop ecological economic model. So I mentioned that there is a lot of interactions between these crises. This slide and the next several really intended just to draw lines to show how one problem impacts the others. And I've highlighted in blue some of the interactions that impact from other problems that impact the problem with toxics and air pollution. For example, in desertification, monoculture agriculture, of course, is a form of desertification. Monoculture agriculture is far less biologically abundant than a natural environmental a prairie or farm or forest. But it requires massive amounts of pesticides. It promotes field burning, particularly in places like China and India, that creates massive air pollution. So there's all sorts of interactions. You could go on for days listing them. Where did my... invasive species, I think, is an underappreciated environmental problem around the planet. But we're deluged with invasive species. If you live in New Jersey, here in the Northeast, you're familiar with them. You've got things like gypsy moths, Asian longhorn beetles, and whatever. But they all mean we use more pesticides to control them, and that contributes to the toxic air pollution problem. And that's a global phenomenon. And where pesticides and chemicals are not well regulated, those contaminated sites proliferate every time a new species comes in. And I will give an example of how that worked out later on in this talk, specifically related to pesticides used to control desert locusts in the Horn of Africa, which is an issue that has caught the news. And those invasive species of locusts, a result of global warming, has resulted in massive amounts of pesticide use, has resulted in a toxic contamination site, which has impacted refugees, and we ended up cleaning it up. Toxic pollutants and toxic contamination also impacts all the other crises. A few of these examples are given here. On the bottom left, pesticides killing off native animals and therefore insects, giving invasives opportunities. It causes fish kills, toxics in potable water supplies. Endocrine disruptors impact reproduction and species health in freshwater, ocean health, the land, and wherever. So just a massive number of interactions between the various different crises that show that you can't address one without addressing them all. So let me turn now to toxic substances and air pollution in particular, in specific. You can divide toxic substances pollution into three major categories: air and water pollutants, toxic chemicals and endocrine disruptors, and toxic contamination sites. And most of what I'll be talking about will be the toxic contamination sites that Pure Earth is working on. But I'll have a few slides about the first two categories. Globally, and when I travel through the developing world, I find that PM 2.5, small particulates, is probably the pollutant and toxic pollutant problem that the public there is most concerned about. You can see the picture on the left is the Golden Temple in Amritsar in 2017. All of these pictures, by the way, are my pictures. I was there that day, and the pollutant levels were at about 600 micrograms per cubic meter versus the US EPA standard of 12, Indian standard of 50. Just record-breaking problems. This is a problem that is that the governments there are most focused on because it's most obvious, and it's affecting the health of millions and millions of people in India, but also in the rest of South Asia, many African countries, Kuala Lumpur, Jakarta, Vietnam, and all over China. Farm field burning is just a huge problem in the northern plains of India, but I showed it here, a picture in Harbin, China. When I took this picture in Harbin, China, the levels there were in the range of 600 to 800 micrograms per cubic meter. So the sources for PM 2.5, power plants, cement plants, diesel engines, forest, brush, and farm burning, and burning garbage. Other toxic air pollutant sources, coal, power plants, and artisanal gold mining for mercury. Pure Earth is specifically focused on artisanal gold mining, which represents about 30 to 40% of the global air emissions of mercury, with coal plants being another 40% or so, and 20% from miscellaneous other sources. Lead smelters, lead acid battery recycling, which I'll talk about specifically, and a variety of chemicals, coatings, and fuels. You'll see the picture on the bottom left. That's in Kuala Lumpur when they had the incidents of massive fire burning, deforestation burning in Borneo and Sumatra that washed over into Malaysia, resulting in pollutant levels again in the multiple hundreds of micrograms per cubic meter. So the solutions to toxic air pollutions are well known. We need to stop forest and field clearing by burning, control forest fires and brush fires. A real challenge these days because they're being increased by global warming. We need to eliminate coal. Coal is on its way out in the United States, eliminated in Europe, in the UK now. You can see the other list of solutions, but we need specific enforcement, particularly in the developing countries, China and India, on the industries that create the worst toxic air pollutions. Persistent organic pollutants result in a lot of contaminated sites that we work with. They don't degrade, sometimes called forever chemicals. They tend to bioaccumulate up the food chain. Fish will eat some of them, say PCBs, polychlorinated biphenyls. Bigger fish will eat those. The materials accumulates in the fat of the fish, and it bioaccumulates up the food chain. The sites here are two really god-awful sites that you can visit. Here's a transformer location where they openly drained PCBs out of those transformers in a field outside Tegal, Indonesia, and drums of abandoned pesticides in central Kyrgyzstan. Persistent organic pollutants are now pervasive around the planet. They're detected in Antarctic waters and ice, and they're in your blood and my blood and everybody else's blood, with health impacts related to cancer, reproduction, obesity, weight gain, and immunity response. And a whole lot of toxic sites that we're finding out there relate to persistent organic pollutants. Endocrine disruptors. sometimes are the same as persistent organic pollutants, sometimes they're not. But they are impacting biological systems at very low concentrations, impacting both human human systems and those of animals, plants, and insects. In their dose response levels are very difficult to determine. Their concentrations in the environment tend to be very low. And you can't separate the dose response from the noise, so they're often overlooked in regulations. This is a regulatory problem. It's hard to identify the impact from the noise. By far, the biggest endocrine disruptor problem on the planet is estrogens, largely related to medications and birth control pills taken by people, most of them passing through the body and excreted, and not removed by wastewater treatment. Only a small portion of the problem is related to improper disposal of pharmaceuticals. But their impacts include genetic mutation and reproductive effects, sometimes pervasive, persistent, but they are pervasive throughout the planet. So the solutions on POPs and endocrine disruptors, clearly we need to get better control of pesticides, integrated pest management. There needs to be a reduction of steroid use in pharmaceuticals, alternate methods, or low steroid birth control, which is effective, proper drug disposal, banning of pesticides that kill bees or otherwise cause ecological impact, such as neonicotinoids, management of POPs and mercury in the various treaties that have been signed for that, and pollution control, particularly in China and India, which are the major sources of these chemicals, but also elsewhere around the world. The lower right, a bean field in Nicaragua, freshly applied with glyphosate, and they're going to pick the beans in about a day or two after I was there taking this picture, and those people will be exposed. So it's, is that a toxic contamination site or not? Well, that's depending on how you define it. That's not the site that Pure Earth tends to work on, but it is certainly a site that is causing toxic pollution and impact on the public health. So I'm going to move now, and for the rest of the talk about the classic toxic contamination sites, dirty places that have been, where they've spilled chemicals or heavy metals, and what those look like and what we do about them. In the developed world, we've done a pretty good job identifying these sites. We've got a lot of government programs in place. There's regulations, standards, fundings. We've got the polluter pays principle. There's been extensive remediation activity in a whole lot of sites. Probably most of the severe sites have been addressed. If not completely cleaned up, at least the risks to public health have been addressed. And in general, the impact on public health from classic toxic contaminated sites, specific geographic locations that are polluted, their impact is decreasing. That's not the case in the developing world. What we see is that there's limited site identification, few if any programs, no or rare liability, often a lot of corruption. So if there is liability, you can buy your way out of it. Little remediation activity, limited expertise to do remediation, and the health impacts are increasing from these sorts of sites due to growing populations, growing economies, and large informal sectors. The informal sectors have limited capital to deal with pollution, little incentive to deal with it because they're flying under the radar, so they externalize the costs of the pollution that they're creating. So Pure Earth has a program we call the Toxic Site Identification Program. that's developing a database of contaminated sites in low and moderate income countries. It's based on a rapid assessment tool. It's not intended to create the sort of data you needed to clean up a site, but rather it's intended to allow comparison between sites of relative risk and get a general idea of the risk that a site presents to public health. It's intended to prioritize further studies. It's done in 1 to 2 days with limited sampling, about 100 data fields or so collected. We have been doing this work since the turn of the century. It really ramped up around 2012, and it's been funded by the World Bank, Asia Development Bank, the UN, the EU, and various other agencies. And our risk scoring and ranking is based on the classic source pathway receptor model. If possible, if we're looking for metals, we often use an X-ray fluorescence. We own a fleet of XRF instruments, such as being used by the woman here in India on the upper right. That enables us to take a whole lot more samples in the field. If it's not available, then we're limited typically to 5 to 10 samples per site. As I said, the focus is on low and middle income countries, 50 or so countries. Specific contaminated sites, not regional problems. We're focused on toxic chemicals and heavy metals, not bacterial contamination, not greenhouse gases, not oil, not PM 2.5, not coal mines. We look for toxicants that are in soil or water above US EPA or WHO public standards, where there's a risk of pathway presenting a risk to local populations. And a key factor in our risk evaluation is the number of people who are exposed and the proximity to the site. Perhaps the first finding that comes out of this is that the greatest impact in a whole lot of countries is often local and small industry, informal industry, or industry in the informal economy, as opposed to multinational corporation sites. Certainly there are a large number of big sites out there, mines and chemical plants and refineries and the like, but those are often separated from where people live, whereas the informal economy is often right in the villages, the cities where people live, and the exposures are greater. So here's a map that shows the spread of where we've been looking at contaminated sites, 50 countries, 5,000 sites. We add hundreds every year. It is not everywhere in the developing world. You can see that there are no sites in Western Europe, in US, or Canada, Australia. Sites are very much underrepresented in Northern Africa and the Middle East. For that matter, they're very much underrepresented in China because our ability to work in that country has largely ended. And there are African countries we can't go to. And we don't work in dangerous places where our investigators would be put at risk. So that limits where we can go, but still, as you can see in this map, we've looked at sites in a whole lot of places. So what did we find? In addition that informal industry is our big source, here's some key findings. Collectively, you've got somewhere above 200 million people's health that are significantly impacted by contaminated sites. Not counting the air pollution from the sites of the regional problems, that sort of thing. Just the sites themselves, over 200 million people. This slide lists the top 10 types of industries that we find are causing toxic contamination. Use lead acid battery at the top, as I've already mentioned, mining, lead smelting, tanneries, artisanal gold mining. Artisanal gold mining is way up there because they use mercury, and I'll discuss that further. Waste landfills and dump sites, they we're measuring just the local impact of those sites. Generally, a lot of those sites have big regional impacts because they're burning and creating all sorts of air pollution. So you can see the other ones. This list includes both legacy and active sites. Most of our investigations tend to be at legacy or abandoned sites, but we do, because the owners of industries don't let us in to active sites. We do look at a good number of active sites, in which case we're looking at the communities around them rather than in the site. So you can look at, on this slide, the sites, the types of pollutants that we're finding that are causing the most toxic pollution in low and middle income countries. By far and away, lead is the most significant in terms of number of people impacted. Mercury, chromium, arsenic, and pesticides round out the top 5. Below those top 5, it gets a little iffy as to how you rate things, but you can see a list of the other pollutants that are in there. You can see from the multicolors on the dots that they are spread. The types of pollutants are spread kind of the same all over the world, with heavy metals being found basically everywhere, heavy metal sites. So the health impacts from these sites, generally they vary according to the pollutant. I'll talk more about lead and mercury, but typically they affect children much more than they affect adults because children have small bodies. Their dose to size ratios is much greater. The bodies are smaller, but proportionally they eat more food for the size of their body. And therefore they ingest more. Children also play in the dirt more, and they're lower to the ground, so they have greater dust exposure. Generally, toxics impact the immune responses and result in higher infection and mortality rates. So very often what we're seeing is not direct death or disease from the pollutant, but a reduced capacity for people to ward off other diseases and infections. And that is what's causing the health impact, is that reduced impact, reduced immune response, their weakened bodies. You can see in some cases direct responses done on organs, or maternal reproduction or cancer. When we find all of this data out, we help governments develop national toxic action plans. You know, it's not enough to just say, here's what we found. We show them the database that we've got. We share our TSIP database with any government who is interested, and various nonprofits at no charge, so that they can use this data to help set their own priorities. And we provide technical assistance to develop such plans and develop the capacity to deal with cleaning up toxic contaminated sites. So as I mentioned, lead is by far the greatest toxic pollutant that we're finding globally, with used lead acid battery sites, recycling sites, often in the informal economy, being the largest source. You can see an example here in southern India. You can see it's pretty dirty business, and what you notably do not see is any personal protection equipment. I'll show some more pictures of these too. So over 1 million deaths a year related to lead, 800 million children with elevated blood levels over 5 micrograms per deciliter, which is the action level in the US. There is no minimum acceptable level of exposure for lead. We estimate 10 to 30,000 in poorly controlled ULAB shops globally, likely more. Some of those are buildings, as you see in the upper right. Some of them are abandoned open air lead smelting, lead recovery sites, such as you see in the bottom left. People work there, in this case in Colombia, outside Barranquilla. It was, they worked there for a year, and then they just left the contamination. They moved on to another site when people started to get angry about their business there. Lead mines are also an important source of lead, and one of the biggest problems we found is in Kabwe, Zambia, on the lower right. So lead exposure routes. Ingestion is by far and away the biggest exposure route at contaminated sites. In particular, children, it's a result of eating without washing hands, children eating soils, licking their hands, chewing their fingernails. Even the dust that they're breathing is largely caught in the nose and the throat and is coughed up and swallowed because it's larger than the 2.5 or 4 micron particle size. Inhalation is a minor route of exposure because only the small particles get to the lungs and cross the lung-blood barrier. Dermal contact is more of an ingestion risk because it doesn't go through the skin. Contaminated food is also largely an ingestion, and the biggest concern is if you're growing crops right next to these areas, which we find frequently, then the dust on the foods can take up lead. The lead that we see at mines and in ULAB shops is inorganic. It's lead oxide or metallic lead, and that's highly insoluble in water. And so we generally do not find drinking water to be a problem at these sorts of sites. Lead can be made into a soluble organic forms like tetraethyl lead that used to be used in gasoline. Bacteria in the soil or in sewer pipes, for that matter, can transform metallic lead into soluble organic forms that then can be ingested and make drinking water a problem. And that, of course, is exactly what happened in Flint, Michigan. But that is generally not what we see at the ULAB sites and mining sites that we've investigated around the world. Health impacts of lead, neurological impact, intelligence and cognitive loss in children starting at around 10 micrograms per deciliter and up, high blood pressure, stomach pain, numbness, disability, with children being the most sensitive, as I've already mentioned. So a few examples of what these shops look like. You can see that they're black and dirty. The dust is black. This is in Bangladesh and 2 sites in Indonesia. You can see the one on the lower right, they are smelting the lead that's removed from the batteries in an open pit with no controls and goes out into the forest and the neighboring houses. This is pretty common. That's all lead dust in that smoke. The process of doing battery recycling involves breaking it, taking out the lead metal and then the lead oxide dust out of it, dumping out the acid, and then taking the lead oxide dust and the lead plates and smelting them in either a furnace or an open pit, and then casting them into new ingots that are sold to make new batteries. Essentially 100% of batteries around the world are recycled because lead is valuable. The amount that's recycled in the informal economy varies greatly from country to country. In India and Bangladesh, where we've done a lot of studying, it's probably 60 or 70% of the batteries are done in the informal economy. Here's an example of a project that we did outside Dhaka in Bangladesh, an abandoned open-air shop. We investigated the site using an XRF. You can see that being done in the upper left. Designed to clean up with the approval of the local Ministry of Environment. You can see the work being done. They're actually digging out the polypropylene dividers that were just discarded on the ground that are coated in lead dust, putting them in bags. They were actually built, buried in a contained facility that was then covered by a floor and a building. The picture in the upper right on this picture, on this slide, is what I think is probably the saddest picture in my whole slide deck here. Those plastic plates that those girls are walking over are polypropylene dividers from batteries. They're coated in lead. And the children are picking them up and they're playing with them. And they're just playing in there. And they are being exposed to massive amounts of lead. Those girls probably are going to end up with a blood lead level above 40 micrograms per deciliter. And you are just looking at children that are mentally crippling themselves for life because it's irreversible, the mental damage, cognitive damage. And you are helpless to do anything about it, at least in the moment. All of our work, where possible, we try to do a before and after blood lead level testing to measure the effectiveness of the work. You can see one of the doctors from the Institute for Communicable, for ICDDRB, it's a medical institution in Dhaka. And here we found roughly a 35% blood lead reduction in the children as a result of this project. We also found that there must be other exposures in the area that the children are exposed to, else their blood lead levels would have reduced much more. So this isn't the only source. We'll move on and talk a little about artisanal gold mining. And here's some pictures of the process in Tanzania, and we'll see this more in pictures related to Zamfara in northern Nigeria. Mercury is used to capture gold from ore. Also, like lead, there's probably more than 1 million people exposed globally, although the exposures are more sporadic because the mercury is not as heavily used as the lead. And as I mentioned earlier, artisanal gold mining probably represents 30 to 40% of global mercury emissions. Mercury is used in gold because it dissolves gold. So you mix a crushed ore with the gold, with the mercury, and it forms an amalgam. You can then separate the gold from the amalgam by heating it because mercury is volatile. The evaporation results in the emissions to the atmosphere, but it also condenses and contaminates the local area where the workers are working. If that's done inside a house, then that house becomes contaminated. And because you're separating pure gold from the amalgam, that's a very sensitive process in artisanal gold mining. It's exactly where the people want to be most secretive. And so it's often done inside houses, inside buildings, resulting in mercury exposures in the inside air. Ingestion of soluble forms is possible. Bacteria can transform mercury into methyl mercury and whatever. But most of the exposure we're seeing is exposure to metallic mercury. Mercury is a potent neurotoxin, damages kidneys, livers, and the brain with various mental problems. And again, infants, children, and pregnant women are most vulnerable. In particularly, the mercury does pass through to children through breast milk and into the fetuses and pregnant women. Typically, the picture in the upper right is what we're seeing. That's a little jar of mercury. That's sold on the black market because mercury is for this use has been banned in almost every country. But it's readily available on the black market. You get a little jar, and you could use that little jar to do a ton of soil. You can get a lot of gold out of that little tiny jar of mercury. So the other industries, and now it's just some pictures of the types of industries and contamination sites that we're seeing. Tanneries, you're seeing a chrome salt factory, and on the left side in southern India. The yellow water that you're seeing is not effluent. That is rain runoff that has accumulated and has picked up chromium, a lot of it chrome 6, the most toxic form and soluble form of chromium. So there's a lot of tanneries around the world, and in the developing world, they are still using a lot of chromium to tan their hides. You can see the blue color on the tannery, on the leather hides on the lower right in Manila. Often done sometimes in open air. So that's a few things on tanneries. Dumps and landfills, big source of air pollution, but also a big source of groundwater contamination. People live around dumps in the developing world. You see rag pickers there all the time. And they are getting massive exposure to both the PM 2.5 that's being generated there in any toxics that are in the landfill. So these sites that you're looking at, one a massive landfill outside Delhi, another one outside Dhaka, and then a few pictures of landfills around Phnom Penh, Cambodia, with the rag pickers, as they're called, but they're scavenging. They are scavenging for plastic, metal, and anything they can find, and they are being exposed. The lower right-hand corner, you can see that they're living right next to the landfill, and so you have very immediate exposures. You could see this anywhere. Medical waste is often disposed of in uncontrolled fashions. This is an abandoned site near Hyderabad. This contributes to the endocrine disruptors going into groundwater. Generally, you don't see direct exposure to people from this sort of thing. The exposure here is generated through groundwater transmission and maybe carrying contaminated soils if people walk across the sites. Pure Earth generally does not look at a lot of medical waste sites, although I have been to a number, obviously in Hyderabad, and also in Argentina, several other countries. Electronic waste is the fastest, by percentage, is the fastest growing waste category on the planet. It contains all sorts of toxics, various heavy metals, and in the recycling of them or the breaking down of them, various solvents are used. Burning of wires rather than mechanical stripping is common. This is a site, pictures of a site outside Accra in Ghana. Those of you know Jack Caravanos, these are Jack's pictures. Jack did the work at this particular site to help them improve methods to recycling, particularly to eliminate the burning of casings and wires to reduce the smoke and to move the processing away from residential areas. but we're seeing this as a growing category because of the growth in the industry. Pesticides, a huge category. The more invasive species we have, the more monoculture we have, the more pesticides we use, and they are generally not well controlled. Many pesticides have been banned globally, such as DDT. That does not mean they're not still being used. And if they have been banned and are not used in developing countries, they're often simply abandoned. And I'll show a picture of that. Well, I showed a previous picture of a warehouse of abandoned DDT in Kyrgyzstan. So these are pictures of a abandoned factory in Salamanca, Mexico, in its dump area. A dump, they tried to contain the picture in the upper right. They tried to bury a whole bunch of DDT in cans in a concrete bunker in Kyrgyzstan. But scavengers found out it was there, and they dug a hole into the concrete bunker, and they took out the pesticides because it got commercial value. And they ended up spreading it all over the place, not to mention contaminating that particular area very badly. The lower right shows a pesticide dump area in Cartagena. In the lower right is probably most often the sort of thing we see with a contaminated pesticide site. It doesn't look like anything. It's a grown over vegetation, whatever. It doesn't look like anything obvious. They might have a sign next to it, but generally not. So you need to have word of mouth to find it, and then you need to go out and test it. And of course, that has to be done with laboratory testing, so it can be quite expensive. But most of the pesticide sites look like the one on the lower right. They're they look like an abandoned field. Chemical and toxic metal sites. On the left side is kind of several sites adjacent to each other related to chromium and various chemicals in Changsha in Hunan, China. Again, you're seeing the yellow water that indicates the presence of chromium in the runoff. You're probably familiar, these sites kind of look like your classic Superfund sites in the US, abandoned chemicals and old tanks and drums and ugly sludge-filled wastewater coming out and contaminating an area. We see these are not as common, as prevalent as they are, as many as they are, in numbers do not approach what we've seen for things like ULAB sites. But still they are there. They often are bigger sites. So here's a picture of the Absheron Peninsula in Sumgayit, Azerbaijan. This is a petroleum oil mining, oil wells and petroleum refining and chemical manufacturing area. And it has been, it's one of the earliest areas where oil was produced on the planet. You know, it was this area that was feeding the armies in the First World War. Guess this is where they got their oil from. Massively polluted. We see this sort of thing. This is beyond the scope of what Pure Earth can deal with. This is the sort of thing a national government needs to deal with. But they exist. The older the site, the uglier it tends to be. That's true both in the US and in the developing world, because people had no regard or no environmental control practices in earlier industrial times. I thought for many years this would be the ugliest place, the most polluted place I would ever see on the planet. I was wrong. Oops. Come on. How do I go backwards here? Of all the places that I've been to, This city, Man Cha, which is outside Hanoi in Vietnam, is probably the most polluted place I have ever seen. It is an aluminum recycling village. They use lead in the fluxes, so there's lead in all that smoke and in the waste that's lying there. The entire town is lined with bags and bags of waste. There is some 50, or were at least 2 years ago, some 50 small informal smelters for aluminum recycling, such as you see in the upper left, creating massive smoke with no controls. The people know that this is polluted. This was so polluted, this was known as the town without children. The people would send their children off out of the town to relatives because they knew it was too harmful for children to stay here. We're looking at dust levels at 300, 400, 500 micrograms per cubic meter every day of the year. So if you want to know what the ugliest place is, the most polluted place on the planet, this is as good a candidate as any. So now I'm going to switch gears and talk about a case study, and two of them, in fact. How am I doing on time here? Okay, well, another 10 minutes and we can go to questions or so. The first one is in Zamfara, which is in northern Nigeria and related to lead contamination. Zamfara is a poor region in the Sahel, long dry season, short rainy season, over 86 degrees most of the year, very conservative, mostly subsistence farming and herding, no power, no phone service, high illiteracy, no improved sanitation, universal malaria infection, a shocking 16% under 5 child mortality. So this is as poor as they get on the planet. The contamination case in Zamfara is probably the worst case of lead poisoning in modern history. The cause of it was artisanal gold mining in 20%. You can see what a lead mine, this informal mine looks like in the upper left. That's the mouth of it. Little tunnels that people, rat holes that the men climb down into. The ore is crushed and then washed and then sluiced, where they particularly add mercury to extract the gold. And then they take the tailings of the lead soil. Turns out it's good to walk on, so they said, well, let's make our paths, let's line our houses with this nice soil because it's nice to walk on. And they spread it all through their villages. They did it in 7 villages in 1 good-sized town. Over 8,000 children at risk of poisoning. We found blood lead levels over 60 micrograms per deciliter with an average around 50. Usually you do emergency chelation therapy at 45. Over 650 children died, and probably over 1,000 actually died when you looked at the complications, and thousands had permanent neurological development, not to mention the adults that were impacted. And you could see one of the impacted children here in the upper left. We had a lot of people working on this project. It was a joint project from Pure Earth and TerraGraphics consultants out of Moscow, Idaho. With the project director was Ian von Lindern from TerraGraphics. We had partners included Medicine Sans Frontières, Doctors Without Borders, who did the treatment for children and provided logistics support. The US CDC went around and surveyed to find the contaminated villages by testing blood. And we had support from the local government, local Ministry of Environment, Ministry of Health, and the local Emir of Ankara, the Muslim leader of the area. The process, first we had to find the villages. That was largely done by MSF and CDC. We had to meet with the Emir and village chiefs to explain the problem, why these kids were getting sick, and get their support. We mapped the 7 villages and 1 town using an XRF, 2 XRFs that we brought in from the US. We mapped every single house and public area to find out where they had spread this lead dust. That was done by local managers that we trained and international staff. By the way, we brought in about 20 international staff to do this, mostly young people. And developed an alternative plan. The plan basically said if it was over 2,000, if the lead level was over 2,000 parts per million, we would excavate it and remove it and put it in a landfill. If it was between 400 and 2,000, then we would cover it with soil. There's only 7 ways to address risk, address the lead contamination risks. Lead's an element. It can't be destroyed. It can only be moved or contained or stabilized. This slide lists the strategies in descending order of risk reduction or ascending order of risk reduction. The best thing is to put this in a secure landfill if you can't recycle it. What we had decided to do here was, as I mentioned before, if it was very high concentrations, we would put it in a secure landfill. If not, we would encapsulate it in place by covering it with clean soil over with 15 to 20 centimeters of a clean soil. We designed and located landfills outside the villages, getting the local chief and Ministry of Environment approval. Constructed 7 landfills, hired a Chinese contractor, the only person with the suitable heavy equipment, excavators and bulldozers and the like in the area. We trained 51 Ministry of Environmental field supervisors to supervise the work, 158 workers. We hired 17 trucks to haul the supplies. We ordered massive amounts of supplies. We found that there were absolutely no dust masks to be had in Nigeria. So we imported over 5,095 dust masks so that all the workers would be protected. Those dust masks were all donated by Pfizer, so good for them. And setting up stockrooms, washrooms, and kitchens and laundry. So it's a big effort. We had 242 workers at the peak of the work. The landfills, fortunately, there was impermeable clay in the area because there were no liners available. So we could build landfills. This picture of several of them. We built 7 of these things in 3 months. We filled bags with soil and then put them in the landfill and compacted them. We manually dug out the soil from the compounds, the houses and public areas, all and put them on trucks and brought them to the landfills with XRF testing to assure that we had gotten all the contamination. And you can see that the dirt looks like any other dirt. You couldn't tell which dirt was contaminated and which one wasn't without an XRF. After removing the highly contaminated soil, we covered the areas with clean soil. We did a lot of villager education, largely done by local nurses. There's nothing better to do public education about contamination than local public health nurses. So they're a favorite of mine. And had to make sure we had good health and safety practices so that we didn't impact the health of our workers. All of this work was done between June of 2010 and March of 2011 with breaks for the rainy season and security issues. Most of the ore processing stopped, largely due to the orders from the Emir of Ankara, religious authority in the area. There was chelation therapy given by MSF to hundreds of poisoned children, but many of them, they didn't have the resources to do all the children. There was not the ability to do lead testing to really determine the effectiveness, but just anecdotally, children stopped coming to MSF's compound clinic with lead poisoning in the village, from the villages that were addressed, so we know that there was some good effect. Never calculated the overall cost of it. Probably $2.5 million, not counting volunteer time. If you had done that in US, this would have taken years and something well over $20 million. So this was a whole lot of effort within a 1 year period. We did test water levels and found it to be low as expected, because it's lead oxide and lead in the ore. We could not remediate everything in the village because they built their bricks with the contaminated soil, and you couldn't knock the houses down to take care of the contaminated bricks, and there's no paint. And some recontamination is likely because gold is valuable. What ended most of the gold work was the fact that gold price declined from $1,700 an ounce to under $1,200 an ounce, and it became less profitable. But gold is now over $2,200 an ounce, or in that range, and this could very well have started up again. There was a lot of corruption. The amount of corruption in Nigeria, at least in that area, was astounding. Quality of supplies was a challenge, and we had limited vehicles and horrible roads. And out of the 20 international workers that I had working for me here, 12 of them came down with malaria. All of them got better. So, and that's despite taking malaria prophylaxis. They were taking the pills. So, a challenging project. I'll do one more case study. So the types of projects and challenges you get. This is related to pesticides in Somaliland. Somaliland's a region of Somalia, but in self-declared independent and de facto separate country in the Horn of Africa, 3.5 million, semi-arid and desert. It's peaceful, but poor. No resources to address environmental contamination. Only a handful of laboratories, but no specialized equipment that we needed to do remediation. Strict Muslim country. Somaliland may be the driest in terms of alcohol, the driest place on the planet. But oddly, cotton, a mildly psychoactive plant, is a common addiction. The compound that we did this project in was contaminated with malathion and DDT. It was previously used as a compound to store pesticides for desert locust control by the UN Food and Agriculture Organization. It was abandoned when Somalia went into anarchy and has not been rebuilt since Somaliland declared independence. So there was public health risks. There was a drainage channel from the site down into the city that presented a risk. And refugees from the rest of Somalia had fled to Somaliland and settled close to the area. And the strong odors from malathion were making them sick. So an urgent problem because of the sickness that we were finding. People nauseous and reporting to the hospital because of stomach nausea and stomach issues. So this project was done in 2 trips in 2014. the first trip to review the work that had been done, to set up a lab. We had to bring in all the immunoassay supplies to measure the toxic contamination levels, assess the site and develop alternatives, and then order supplies. Particularly, we had to order in overpack drums and all the PPE that was going to be used. The second trip is when we did the work. We hired the labor, local labor, heavy equipment, and did the work. And the next slide just shows that the work's in progress. The upper left, inside the warehouse where the malathion spill was, the drums are still partially full. So that's what it looked like before we started. You can see the right is overpacking the old drums into a salvage drums, which we imported, and then shoveling out the contaminated soil into more salvage drums. Then transferring the drums to a shipping container for future shipping to Europe, and covering the spill area with plastic and then clean soil. The eventual results, the malathion was contaminated soil was packed and ready to ship to an incinerator. The soils and covered and reduced, the odors were reduced, impact on neighbors was resolved, and a plan developed to bioremediate DDT was developed. So I'm going to hold here and maybe see if we can have some discussion, if there's any questions where we're going. Hello? Everybody is
We're here. Let's see if Mike Gotchville is in here. Hold on.
I have unmuted myself, and there are two ways to do questions. If somebody would like to volunteer a question, to unmute themselves, and if that gets awkward, we'll have people put their questions in the chat. But I know that people are very shy around EOHSI, so it may take them a few moments to think, unmute themselves. So I'm going to ask a question. Our association as a department is with the School of Public Health, and we have many public health students, all of whom need some practical project or experience. And I wonder if it's feasible to connect students with the work that Pure Earth does, or if it's too complex for, let's say, to have a student 3-month participation project.
We have been asked to, take on interns and students before. There are a good number of problems with doing that. Beyond the liability and logistic issues, the two biggest issues are, first, that our primary focus in terms of capacity building is to build capacity in the countries that we're working with. So we often are working with Ministry of Environment, Ministry of Health people, local university people, and local consultants, and spending all of our time teaching and building their capacity and education. So that's the key focus, is to make sure this capacity is local. The other one is simply money. We don't have a lot of money to send people around the world. That doesn't, the Zamfara project was an exception because of the urgency with children dying, that we could bring in some younger people and train them up in the field. But for the most part, the finances are such that unless they were self-supported, our budget can't afford to ship people around the world, particularly if they can't add a whole lot of value and they're still being trained. That doesn't preclude some sort of opportunities to have collaborations and training, particularly if there's funding for those sort of people, for the students. You know, if they come with money and they can travel, there may be some opportunities. I would say it would be limited, though.
We will certainly keep that in mind. I can imagine that it's not a trivial task to connect students to projects. We experience that ourselves.
And you know that there are liabilities here. If you're sending people out to contaminated sites, you need to have a good attention to who you're sending and the health implications of those, and in some cases, security implications. So,
okay. So Derek, would you like to voice your question that you put in the chat?
Yeah, hi, Michael. I just wanted to make sure everyone could see this link I put in the chat. So, John, thanks so much for a great talk. I'm also in the department, but I'm based at the School of Public Health, and I definitely, like the others, have to cover lead and many other heavy metals in the core class. What I put in the chat box is I was wondering if you could say a little bit more about the recent initiative that your organization started with UNICEF and another organization regarding a partnership to protect children. And it is focused, to my understanding, on lead, although I know you presented on many other metal contaminants today.
Yes, I'd be glad to. Yeah, so the, I forget the exact name, you know, letting every child develop to their potential or something to that sort of name. It's a partnership with the United Nations and the Clarios Foundation. The Clarios is a company that deals with lead production. And it is focused specifically on lead with a few key attributes on it. A strong focus on used lead acid battery, and looking at how can we develop systemic solutions to this problem. We're not going to clean up every site, but we can, maybe there's a way to work with governments to get better control of battery recycling so we're not creating new sites. You know, what has worked in some countries to get batteries into well-run recycling facilities, and as opposed to these informal, poorly run facilities. So that's kind of the focus that they have within this initiative. The funding that we have is focused on a handful of countries, like Bangladesh and Georgia and Ghana, rather than all countries, because the idea was let's identify a few countries that we know about and we think we have a good chance of working with to change policies and create policies that have effective battery recycling. And then if we are successful in countries like Ghana or Bangladesh, then we could use the same approaches in other countries. So we hope that it grows to other countries from the 5 that it starts with. I'll just note that there's a little side light on that. As a result of work that we've done in India and Bangladesh and Georgia, we've also found in certain areas that there is a problem with lead adulterated spices, particularly turmeric. And people eat it, and that's direct ingestion of lead and results in higher blood lead levels. And so there's the Clarios, this partnership, and the Clarios Foundation is also providing some funding to do further work on the lead adulterated spice issue. And Pure Earth is looking at that as well, in cooperation with a number of other organizations, notably Stanford. Yes, the nest, I see in the chat.
Muted, Mike.
You might have known Leah Ziskin in the State Health Department, who uncovered a lead battery recycling in Trenton that accounted for a number of lead poisoning cases.
Wow. No, I wasn't familiar with that one.
I assume that such things might still be going on in various U.S. cities. Well,
my knowledge is that in the United States, we pay a fee that when you buy a battery or you buy a car with a battery in it, there's a fee on that battery. And when you return batteries to the dealers, they send those batteries to approved smelters for recovery of the lead. And there's only a handful of those in North America that do that sort of work. So for the most part, I'm not aware of, I haven't investigated, so I wouldn't know, but I'm not aware of the sites in the US that are doing illegal battery recycling. But for the most part, it's going to just a handful of good approved sites, our batteries. Another point on batteries, our car batteries tend to last, 4, 5, 6 years. Some people never change their car batteries. Lead acid batteries in cars, trucks, motorcycles, motorbikes, and the like in low and moderate income countries tend to last 2, maybe 3 years at best. The quality is much worse, so the amount of battery waste per vehicle is much higher. The people don't have money to buy high quality batteries, so they buy whatever they can. Even though if they bought a high quality battery, it would probably be more economic for them in the long run. But that's part of the problem that will be looked at with this Protecting Every Child's Potential initiative is what can we do to improve the quality of batteries so we don't have as many to recycle. Any other comments, discussion?
Yeah, I would like to ask a little bit. So in many ways, what you talk about is a moral and a justice issue. And some of what you talk about is out of our control, but obviously, as you spoke about, our consumption and the impact on the rest of the world is not. My question pertains to the role of corporate entities from our Western world, basically, and how are they contributing to the problems you talk about by trying to fly under the radar of lacking regulations and monitoring. And basically the question of what we can do about all this from our points of view, from our positions here.
Oh, it's a good question. I'm saying a lot of what we've talked about. First of all, I agree. There's an environmental justice portion of this. These people who are being exposed to these toxic contamination sites or PM 2.5 or the other pollutants don't have a choice where to live. They have to live near the sites. The sites are not well segregated. The worst, they're always located in poor areas. The wealthy people keep them well away from themselves. So that environmental justice is loud and clear when you walk through these sites and these areas in any of the low and moderate income countries. It's rare that I see well separated sites. A major project that we did outside Hanoi in Dang Mai, Vietnam, the big effort there, half the solution was moving the lead acid battery recycling shops out of the village to an organized industrial area where they could put in better controls and at least keep it isolated from the town. And in that case, the local government was well aware of the environmental justice aspects of what they were doing. and took action, much to their credit. They also paved all the contaminated roads, which was a big step in that area. And as a result of our efforts and the local government's efforts, we were able to reduce blood lead levels over 75% in that village, where we started off with averages around 40 micrograms per deciliter. More to your point about what we can do in the US, major corporations have outsourced a lot of their supply chains. That varies by industry. I'm most familiar with the pharmaceutical industry that has outsourced a lot of its production, notably APIs, active pharmaceutical ingredients, to China, and a lot of dosage forms to India. And those Chinese and Indian companies in turn have outsourced a lot of their supply chains within their countries to smaller manufacturers. And the further it gets away from the multinational corporation and the supply chain, the greater the likelihood that you're dealing with an informal or poorly behaving industry. So when we deal with multinational corporations, many of whom set up evaluations, social responsibility evaluations within their supply chain, including environmental factors and hopefully environmental justice factors, what we should be doing is advocating that they do not stop at just the first supplier, but they go all the way back through the supply chain, because the problems are likely to be 2 or 3 steps back. And not all corporations are doing that. So we have a chance to advocate for better environmental justice in the supply chain that impacts these developing countries. So that's one idea, what can be done.
I'd like to thank you for the presentation. I'm sorry I got on a little bit late, but I guess you're my alter ego. I wish I had the guts to travel around the world and do the kind of work that you're doing. As a clinician in the US, having dealt with lead-poisoned kids since the mid-60s, it has always amazed me that we still, in this developed country, still have such kids that come in with elevated leads. I retired in 2016, and I had hoped that by the time of my retirement, I would not see another case of lead encephalopathy. And in the spring of 2016, we admitted I think she was a 3-year-old girl with lead encephalopathy and a lead level of 125.
A lead level of what?
125.
Gee, that's near fatal.
Well, you know, I must tell you, over my 50 years of practice, I've had several kids with lead levels over 300 that survived, you know, relatively untouched. I mean, there is a wide range of susceptibility, and the kids with the lead, it was a set of twins with lead levels over 300 that literally had normal psychometrics. It was astounding.
That's amazing.
But anyway, to get off the subject of lead for a while, and by the way, if you've had batteries in your car last more than 3 years, you're a better man than I. It seems as if the warranty is 3 years, and every single time that I've had a battery replaced, it's like 1 day after the 3 years. But what concerns me now, as I'm driving a electric car, a rechargeable car, and those are lithium batteries, I believe, lithium halide of some sort. Now, I don't know whether anybody knows what the potential toxicity is from low levels of exposure to lithium over time, and I have no idea how you dispose of those batteries that are in the automobile and will be increasingly involved. Do you have any thoughts? What are we doing, and how are we going to protect ourselves from creating a new lead or asbestos or whatever disaster you want to consider the contamination of the environment to be?
Yeah, good question. The lithium batteries, most of them are still, that have been produced, are still living, and they're in cars. They are recyclable, and the lithium is valuable. And I am not familiar with the recycling infrastructure that has been set up to deal with that. You're not seeing a lot of lithium ion batteries in the developing world, so we don't see that problem out there. You will see it in China. But it is recyclable and valuable, so I'm assuming that people will respond to the market need and create that demand. Small batteries, such as you find in small electronics, are a bigger, in some ways, a bigger problem because they're too small to recycle and people just tend to throw them out. And they may be lithium, they may be nickel, cadmium, or other substances. And they present their own toxic metal problems in the landfills and the electronic recycling shops that we're going to. So I'm less worried about vehicle lithium ion batteries than I am the batteries that go into electronics, because I think they present a much bigger environmental risk. Lithium in general, I do not expect to have the same toxicity issues and long-term health impacts that you'll find from lead. Just that it doesn't have that same sort of profile. But cadmium does. So, those small electronic batteries could be a real problem.
I should take the liberty of introducing Dr. Stephen Marcus, your last questioner, who was the head of New Jersey's poison control and probably saw more lead-poisoned children than perhaps most pediatricians combined. We also had experience that there's great variability in the response to different lead levels. This is going back to Lincoln Hospital in New York in the 1960s. But it's certainly remarkable that we heard little bits and pieces of the Nigerian episode leak out, trickle out, but it mostly passed under the environmental toxicology radar screen, and certainly sounds like the hugest recent lead poisoning event.
The maximum number that I recall in Zamfara for blood lead levels for a child that survived was around 600, tested by MSF.
Wow.
Which shocked everybody. I understand that the impacts can vary widely from child to child, and we deal with average statistics when we talked about cognitive development impacts. That makes the communication of risks a real challenge in the developing world. You go to people with little education, or they may be illiterate, and you try to tell them that there is something in that dirt that your children are playing in, or those plastic dividers that those girls were playing in Bangladesh, that is going to cause them to have mental retardation for life, or significant loss in mental capability. And you're talking to them like there's magic fairy dust. They said, I can't see anything. My kid is behaving fine. I don't see a problem. So public education is a real problem. Particularly, you'll have some children that are fine and they've been playing this stuff for a long time, and other children look terrible and they can't see a true cause and effect relationship in many cases between playing in the bad dirt and how that's impacting the child's development. There's also a lag time. So they play in it when they're 3 years old, and you don't find out about the cognitive development until they're 10 or reach puberty. So this public education is a major problem, It's one of the reasons why the use of local public health nurses, they know how to talk to people, is invaluable. You know, bless the public health nurses of the world, including this country right now. But yeah, we're seeing that as that variability and the ability to educate people is just a huge challenge in these sort of sites.
Other questions or comments? I'm hesitant to say that the opposite risk communication story is problematic here in places like Flint or Newark, where there's a serious problem of lead exposure, but the lead levels have mainly been in the range where you'd expect a statistical change, and yet you have people going around and labeling these children as permanently impaired when their blood leads may have not gotten above 15, which was the average when I was growing up. So I think it's a complex risk communication at both ends.
Yeah, so the blood lead levels that I've read about in Flint, and you probably know more than I do, we're in that 10 to 20 range. The average that we're seeing in Bangladesh, you know, that the study done by ICDDRB and Stanford has done, plus what we've seen, we're looking at a background level of 9 to 12. Mm-hmm. So you start off with 20 and you go down to 12, you've gone as low as you can, and the rest of the exposure is due to spice or whatever and lead in the environment. Not leaded gasoline, that has been phased out almost everywhere, essentially everywhere. So yeah, levels that would create fear in the United States are dirt common elsewhere in the world. And we need to deal with that. But
you know, part of it is the misunderstanding of the research that is constantly quoted by saying a lead level as low as 3 or 5 can cause lifelong disability. That's the area under the curve calculated average daily lead level, which is, I mean, I've tried to figure out how to do those calculations to look at kids that I have followed to see where they would stand. And I must tell you, it's a little bit above my capability. So that it's not really fair to say, and there's also a problem with how we did leads 50 years ago and 40 years ago. And the difficulty in avoiding contamination of specimens. And I dare say a lot of the leads in the 60s and 70s were reported as higher than they probably really were because of the difficulty in having a clean lab. But I really get bothered when people start saying, well, you know, we all had lead exposure and we did okay. That is not looking at a population. And yeah, there's no question that kids in Nigeria, I have a couple of friends that were there, and actually they had me help them get Suxamer for treating some of the kids early on. But it's you know, it's really a complex social problem, both here and overseas. And your comment about recycling, you know, I don't know what percentage, I read it some time ago, at least 50% of the recycling from America is done overseas in underdeveloped countries. We send our trash, if you want, yeah, I hate to use that term, we send our trash to a lot of other countries and we contaminate those countries. So, I mean, that justice has to be looked at by our society.
That's particularly true with electronic waste. Mm-hmm. There is no good economic recycling of electronic waste in the US. So that site that I showed pictures of that Jack Caravanos worked at in Ghana, that was getting electronic waste from Europe and America. And you see that frequently. And as I said, that's a growing area. And yeah, that's an environmental justice problem if we can't take care of our own stuff. One other thought, lead paint has been a major focus in the US, and rightfully so. We have not seen lead paint to be a big driver of lead exposures overseas, in low and developing countries. For whatever reason, maybe just the other sources are so much bigger. But the focus on lead paint is not there overseas. And the lead exposure from tetraethyl lead has been phased out. Of course, it takes a long time to get it out of the soil and really remove it from the environment. It doesn't migrate. But you know, it's stuff, it's batteries, it's PM 2.5 and the lead fraction that's in that, it's coal, stuff like that that's causing the lead exposures, and some spices apparently. Another thing I didn't mention is that we really can't measure when we're looking at these in terms of public health impacts is the synergistic effects. We know that the impacts of lead or other toxics is going to be much worse where you've got these extreme levels of air pollution. You know, they are synergistic, so you put a child in a heavily air polluted area and with a burning dump nearby, and then a lead smelter, use lead acid battery site near that their father works at or mother works at, the impact is going to be way worse than it's just one of those factors.
Okay, a last minute comment, or should we thank John Keith for a very interesting and far-reaching, disquieting, but not surprising perhaps, presentation?
So I'll share some final slides, just
okay.
My final thoughts here. The solutions that we have, probably not surprising to anybody, that we need to re-engineer products to reduce toxics, waste minimization. We need to take care of it at the source. We need better hazardous waste management regulation. Electronic waste shipping shouldn't be done. You know, we should be handling it in our own country. We've got problems with mining practices. There's a whole lot of work that we, Pure Earth, would like to be doing, and hopefully this new initiative will be setting some guidelines and good practices for on working with the informal sector. We need to end the mercury trade that supports the artisanal gold mining. Most of that mercury is coming from China and other poor countries, Congo and that sort of thing. It's been a real problem to end mercury trade. We need low pesticide farming. There's all sorts of things that are needed to solve this, but the summary is over 200 million people are affected by toxic pollutions. There's hundreds of thousands of hot spots. It's under-recognized, underfunded. As we mentioned, major toxics are lead, heavy metals, pesticides, and POPs, often caused by local and artisanal industry. There is no one-size-fits-all solution. We go out, every site needs an engineer and professional people to look at it and figure out what needs to be done. So it is a major capacity building lift in these countries where that sort of expertise, where the educational institutions don't have the expertise to train people to do this sort of work. So that's my kind of my closing thoughts.
Okay, well, thank you very much for this presentation and for the opportunity to get to meet you and Pure Earth. And we'll no doubt have opportunities to ask more questions or learn more about different problems. So,
well, thank you for having me. I hope you all are interested in Pure Earth. Our website is pureearth.org. You can read more about the work that's being done. They're always looking for contributors, of course, particularly for corporate partners and people that are willing to help out with this sort of thing. So,
you have a report on some kind of periodic report on the worst places or something?
For years, Pure Earth, for about 10 years, Pure Earth put out a report called The World's Worst Places. That was phased out in, I think, 2016 or 2017. It was a partnership with Green Cross of Switzerland, another NGO that has ceased operating, so we don't have the funding to do that. But some of what I've just reported, some of the tables I showed were from that World's Worst report in 2016. They are in the archives, but unfortunately there's no new reports coming out like that. Pure Earth, based on our many findings, has switched its focus from everything to more focused on lead and mercury, while also continuing the toxic site investigation program so that we keep building our database and being able to share that with governments and NGOs. But no, there's no one perfect report that highlights all of this stuff. You'd have to dig through the data. There's a ton of reports in the UN, UNEP, UNDP, but not one spot.
Okay, well, thank you then.
Thank you.
And thank you everybody for participating patiently. And we'll hope to see you again at our next seminar.
Okay, thank you.
Bye.
Thank you. I am the host, I guess.
Thank
So
you.
I have to end it.
Thanks for your work.
Thank you very much.